My name's Katie Clow. I sit on the National Issues Committee for the CBMA. And I am really excited to welcome you to our third session on our sustainability webinar series. So the Canadian Veterinary Medical Association and the Canadian Animal Health Surveillance System have teamed together to sponsor this. And the series has been delivered by Veterinary Sustainability Alliance and directors within that organization. So it's my pleasure to introduce our two speakers today for Pathways to a Sustainable Clinic Part 2. And today really focuses on the in-clinic activities. So probably what many of you have been looking forward to. So we are joined today by Drs. Diccon and Westworth, who is a veterinary neurologist who practices in California, and Dr. Colleen Duncan, who is a professor at the University of Colorado. And they're both directors of Veterinary Sustainability Alliance. So I'm going to hand it over to them for what I know is an action-packed webinar today.
Thank you very much, Katie. So yes, my name is Duncan Westworth, and as we can recall from webinar 2, we talked about building our foundation and setting ourselves up for success, and we looked at those 4 pillars to that core part of the pathway to a more sustainable clinic. So we talked about convening, starting your clinic sustainability team, being inclusive and supportive of each other. And Katie and myself both gave examples from our facilities. We talked about assessing, gathering data on the ecological and carbon footprint of your clinic, using a carbon footprint calculator, and also understanding the inventory with a greenhouse gas protocol assessment. We then talked about reflecting and reviewing that information, identifying priorities to finalize a series of team goals, and then planning, developing that implementation strategy with milestones and deliverables, and coming up with a series of actions. And that's where we're really going to take off today. So it's about building from that foundation and then implementing these actions to measurably reduce your hospital's environmental impact. And I've been doing this for more than 2 years at my clinic. And so many of these are going to be examples that you can readily implement at your clinic. And I've tried to come up with as many Canadian examples to make sure that it's absolutely transferable to your situation north of me. So we're going to look at energy. We're going to then look at waste, water, procurement, and also transportation. So let's start with energy. First, we're going to be talking about using less energy and then using more green, renewable, clean energy sources. So let's start with a simple one, improving energy efficiency. These are often easy ways to reduce your impact with some effectiveness. We often consider them low-hanging fruit opportunities and early gains to celebrate. And certainly the cheapest and most effective way is to use less. So be energy efficient and really try to reduce that use. Contacting your local utility provider for more information can be very instructive. My hospital got a free walkthrough and an energy efficiency assessment from our utility, Sonoma Clean Power. And this was a really great collaborative effort that we have now extended. I'm going to be giving you all the other examples of how we've worked with our utility. Switching off appliances and lights when not in use is a very simple one. I worked for a VCA in California, and this pun, pause to turn off, these stickers are throughout our hospital. Using motion or automated switch off or occupancy switches is really, really useful. And we have those now throughout our hospital. Also, for those computers that are not part of the ER department and other devices that are not part of the ER department, we have power down between 7 p.m. and 7 a.m. Where they go on either sleep modes or go off. Another important thing is when you don't have a device that does not have that automated, you can use smart plugs to remotely time use periods. We've purchased those, and they can now also record our energy use for certain devices, which is really instructive. We've also installed LED lights throughout our hospital now. So over the last 2 years, we've been transitioning away from those fluorescent as they've burnt out or stopped working, and installed LED lights now throughout our hospital. Using natural lights also really important. So again, throughout our hospital, on the periphery are offices, and also our surgery suites. And so this allows us to use that natural light. Likewise, we have 2 large skylights in our huge treatment room, which also provides wonderful light during the day. Purchasing highest energy star, reliable and readily serviceable appliances are really important, and thinking about where you place them, particularly things like refrigerators, making sure they're away from heat sources, have adequate ventilation, and if you can, try to maintain them 2/3 full, because there'll be greater efficiency with those. And then turning off laser printers or powering them down to the lowest setting you can is really important as well. They're an egregious consumer of energy, or transition to maybe inkjet printers or avoid use completely. We're not quite paper free yet, but we're really very, very low paper use hospital now. And then another thing is very, very important is to try to reduce the thermostat settings for winter, and then slightly higher in summer, as you can see here. We always try to have people dress for the season, maybe putting on a jumper in winter, using ceiling fans, particularly in a larger, very high ceilinged treatment room, or in offices and things like that. What I can tell you is that if you don't have staff on board and they all bring in their own little heaters, that is one of the most inefficient ways to heat or cool your hospital. So really try to make sure that everyone's on board, and it's also comfortable for the patients. So that's another important thing to keep in mind. Laundry, combining washing loads, washing on a cool setting with appropriate detergents, particularly those low in phosphates. Using a clothes line instead of a dryer is really important, particularly for things that might be shedding a lot of microplastics. So you can do that with like the fleeces, we use that for that, and also for our reusable potty pads and other materials wherever we can. Consider building upgrades, including insulating hot water pipes, replacing door seals to reduce drafts. So we've now done that throughout all our exterior doors to our hospitals, sealing gaps and cracks. And then a relatively cheap window film by 3M and other companies can also significantly reduce heat loss or gain. Now, obviously, improving the building envelope is going to be the best way to do it, but it's more expensive. And so improving wall and roof insulation, increasing building shade with eaves, retractable awnings and plants where appropriate are also great ways to do that as well. So let's move on to using better and clean energy. So one thing we want to do is try to electrify everything. We want to get rid of those fossil fuel powered appliances like your furnaces. And we want to transition to clean, local, renewable generated power wherever we can. So when we're using better, we want to be trying to use electricity and electrify everything we can. That's attending to those scope 1 emissions that we learned about last time. The scope 1 accounts for something like 7 to 14% of emissions from healthcare facilities. And this can be saved by replacing those stationary combustion devices like an oil or gas furnace with a heat pump, or gas water heater, again with a heat pump water heater. Gas clothes dryers that could be electric, and or an electric gas heat pump water heater to replace that gas dryer. Mobile combustion as well. So if you have business cars or ambulatory vet medical vehicles, transitioning to maybe a Ford Lightning or something else, an EV would really be great. And now they can do up to 500 kilometers range. These are very, very available and can absolutely eliminate some of those emissions. And if you're not ready to replace your appliance, putting an appliance replacement plan by contacting your local installer is a really great way. Then you're going to be prepared. And we did that with our water heaters. So when the gas water heater eventually was unrepairable, we could very quickly put in place a heat pump water heater. Also, always make sure you use high energy star appliances where at all possible. And then we want to go and use electricity that's from clean renewables where possible. So as you can see here in Canada, because you have so much hydro, which is wonderful, only about 6.7% of greenhouse gas emissions by economic sector actually come from electricity generation. In America, it's closer to 25%. So one of the easiest ways, and there are provinces like Alberta and Saskatchewan, and we're going to learn about in just a moment, that use more fossil fuel-based electricity. So switching to 100% renewable, zero or ultra-low carbon electricity and reducing those scope 2 emissions are really, really important. And it's been estimated in healthcare, at least in America, that can maybe reduce those emissions by 11 to 15%. So go that renewable, zero low carbon from solar, wind, geothermal, or hydrokinetic electricity generators. And we did this at our hospital, and I'll be giving you an example of that shortly. And I've been surprised at how increasingly available these low carbon options are. So certainly contact your local utility, make sure you speak to the appropriate commercial representative for your hospital, but also just as residences, you can also do that. And sometimes they have simple opt-in links. Certainly where I live, we have that. And then you can consider even putting in solar, so photovoltaic cells, or maybe on your roof, or even building a bit better would be to build shade structures on your car park, and then maybe placing solar on top of those. For certain areas, you could also use surface geothermal heat pumps as listed here too. Now, the energy consumption, electricity consumption trends in Canada have been increasing. More people using more energy with higher energy appliances. For us at our hospital, we put in an MRI, and that's our most egregious electricity use appliance. And, you know, over this time period of maybe 22 years, as shown here, residential sector has increased by 23% and commercial by 40%. And that adds up to a total of about 61% of all electricity is used by us as residents and us in business. And that certainly includes the veterinary sector, doesn't it? So we very carefully have to look at how we can mitigate these and other causes of emissions, because many of the solutions are very much in our hands. But the good news for Canada is that you, over this time period, have reduced the emissions by 53%. And you've done that because you have so much now low carbon electricity sourcing. So in Canada, a large amount is hydro. So in places like Quebec, Ontario, and here we see in BC, you're using very, very low carbon electricity sources as shown here. In other provinces like Alberta and Saskatchewan, a much higher fossil fuel dependence. And there's also still quite a lot of nuclear. It's a bit of a complex slide, but really what I've done is I've then done the maths for you, looking at carbon dioxide equivalents kilos of carbon dioxide equivalents per megawatt hour. And we'd introduced this in the last webinar. You can see here, Quebec is 1.6, BC 6.9, Ontario 24. Very, very low emissions from your electricity per megawatt hour. But in places like Alberta and Saskatchewan, a lot of work still needs to be done to reduce the emissions here. And so I've got an example here of what you can do both in your home or at your practice. And so there's green tariffs. This is an example from Alberta, EPCOR, where for 2 cents per kilowatt hour, you can actually reduce your emissions to 0 from electricity sourcing. How much will that cost? You know, it depends on how much electricity you use, but maybe for a small to medium clinic, it's going to be somewhere between $500 to $1,500 a year. So somehow that is going to have to be cost accounted for, but I think it's definitely very worthwhile. And hopefully your staff and clients will definitely appreciate the work you're doing to reduce your emissions from your practice. Now, my hospital recently transitioned to 100% renewable ultra low carbon electricity source, as you can see here. So we've gone now to evergreen, shown here at 70. And so 70 pounds of carbon dioxide equivalent per megawatt hour. The average Californian utility is about 422, and that's about half still of many, many places like in Missouri and Ohio, etc. And so where's this coming from? Well, most of it's coming from geothermal, as you can see here, maybe 87%, and the rest is solar. And you can see here, when we look at this power mix, evergreen comes from eligible 100% renewables, whereas classic California, at least back in 2022, it's improved a little bit the last couple of years, is actually based still 36% on natural gas. Any coal is actually coming from transmissions from Nevada. or elsewhere. And then definitely you want to celebrate your wins and collaborate with your local community. We did this with our utility provider when our hospital transitioned to 100% renewable electricity. So we put on a community celebration at our hospital with the assistance of the local Chamber of Commerce. We had representatives from many local businesses attended and the general public, and that's really a great community outreach. We also got great press traction as well, and we continue this collaboration with an e-bike grant that I'm going to be discussing later, and also an EV incentive program for charging at our hospital. We've also co-advertised and marketed, including a huge freeway billboard. So lots of opportunities there, including community engagement. And now I'm going to turn over for procurement to Dr. Colleen Duncan.
All right, so thanks everybody. Yeah, our next big action category here is procurement. And as I'm sure you resonated in Diccon's presentation on energy, we often open with energy because of the opportunity to really move the needle, and also because there are such big opportunities right now that vet clinics can take advantage of. But also, I suspect you heard in his narrative the importance of making choices, right? So when we think about procurement, we think about how we can really make the type of change that we want to see. And I've always appreciated this quote: every time you spend money, you're casting a vote for the kind of world you want. And on the next slide, you all who were in attendance at the last presentation talked about scopes, and Diccon has already mentioned the importance of scope 1 and 2 as he talked about energy. But I'm showing this slide again just as a reminder about this scope 3. So that's the gray area on this figure here. And this is obviously for the human healthcare sector. This is specifically in Canada. But as you can see, scope 3 emissions, which are effectively all the stuff we buy, not energy, but all of the other stuff, is a huge part of our carbon footprint in healthcare. So anything we can do to address that will help our clinic meet the climate and environmental sustainability goals that we seek to achieve. Next slide. So I'm going to speak really high level because Diccon has some really fantastic examples of specific changes that can be made. But I really want to highlight in this procurement section the importance of thinking about procurement in all of the spaces. So as Katie mentioned, I'm a prof here at CSU, and I talk a lot to the students, and we jokingly call these the procurement pearls. So there are things that you can do in all of these categories: non-medical, medical, the way we get our stuff, and then things that are not even clinical, but veterinarians have the opportunity to influence. Next slide. And another really important piece that was introduced in the last webinar is the importance of policies around procurement. So this is just a screenshot of our environmental sustainability policy, procurement policy here at CSU. It's open. And that is a really important part of identifying clinic goals and deciding how you want to use your procurement or purchasing power and what you're willing to do to make change, whether that's a willingness to approve the procurement or purchase of items up to a 10% cost difference if they've shown to be in alignment with your policies. But it is really important to integrate this procurement piece into your policies early as you're planning how you want to make your clinic more sustainable. So just if you missed the previous webinar, just a plug for that about how that should really inform your purchasing decisions. Next slide. So I mentioned that there are all these categories where we can drive change with our procurement. So first, I want to highlight that overwhelmingly the stuff that is bought in veterinary clinics and in human hospitals is effectively non-medical. Sometimes I think as the veterinarians or team members, we really focus on these healthcare specific or medical specific items and really want to find solutions, which is important. But I just want to highlight and drive home the message that so much stuff is non-medical, and for a whole bunch of that, there are solutions. And for those solutions, the easy button is effectively getting to know what third-party certifications are options and which ones you can get in your area. So I've highlighted here, Diccon already mentioned the importance of Energy Star in all your appliances, but things like, purchasing from the Forest Safety Council, FSC paper products, EPA has Safer Choice certified, cleaning products, all that type of stuff, clothing. You can look for these labels, know these labels, and put this in your procurement policy that you will preferentially purchase for these. The other thing that's important to think about in this kind of non-medical area and medical actually is how you look for certifications. So for example, some companies are themselves as a company certified by something like a B Corp or certified climate neutral or 1% for the planet. That is kind of an easy button. If you look for companies that have products, multiple products that you might be interested in procuring, you could just go down that road. It is much more complicated to think about buying individual products or a product by product decision. Really to do that, and it's kind of beyond the scope of this presentation, but we need to think about things like a complete life cycle analysis for individual products, and not just sort of the development or the building of that particular product, but an awareness of the circular economy and the importance of what is the end fate of that product? How often can it be used? Those types of things. And then I also want to put a little plug in here. Sorry, just on the last slide, if you missed it, veterinarians, we do sell some pet supplies, but we also talk to a heck of a lot of people who have animals. And so this is the sort of beyond the clinic plug that I want to put in there, right? There is an organization called the Pet Sustainability Coalition. They don't oversee veterinary products, although there's some engagement with the veterinary sector. But if you're going to put toys or treats or whatever that looks like, choose food products or whatever, you can look for things out of PSC or learn about and join their community to learn more about these sort of non-medical but animal-specific products. Next slide. This is a link to something that we developed here at CSU. It is due to be updated with VSA and CSU, and we're hoping to be able to update to a third version. But getting into that medical or veterinary specific, how can we make choices and what choices are out there for more sustainable options? So these are some, they're now veterinarians, amazing veterinary students who worked on the last edition and effectively sent out a survey to every veterinary company that was listed in the compendium and asked, hey, do you have a sustainability policy? We weren't even at that point evaluating their policies, but do you have an outward-facing sustainability policy or products that are third-party certified that we could promote or that make it easy for people to make decisions? And sadly, a whole lot of people didn't even respond to the survey. And of those that did, there was only a very, very small number of companies that had procurement or that had sustainability policies at all, much less that were public facing or that had third-party certifications. So there is some information about the companies that do, or at the time of the last book, have policies that can help inform your purchasing. But in the next slide, I think that this activity highlights the importance of driving systemic change within our industry and the companies that service us. So on the next, yeah, thank you. That brings me to my next point, and one that I think is really so important is how we as a community can come together and drive that. So it is difficult as a single hospital. If you're not part of a big network, your purchasing power, your buying power, you might feel like you don't have a voice. But this is the opportunity to really come together as a community, and something that we hope that VSA can help to facilitate when we have these conversations with our suppliers, our distributors, and even just amongst ourselves about how we can collectively use our voice to kind of drive that change, knowing how much of an impact that has. This is just a screenshot of a recent, I think it was VMX maybe, trade hall. Every time we go to these events and we walk around, first of all, don't pick up all that junk. And second of all, start spreading the message. It costs absolutely nothing to ask every one of these vendors, hey, do you have a sustainability solution? Or hey, have you provided any sustainable options for this product? Things like that. Start the conversation, really drive that change, and share what you are expecting, to see in our industry and the companies that serve our industry. Communicate that both within your sort of personal networks, the people that you work with. It's also an opportunity to talk to different sort of professional societies and build that collective voice. That's why it's so important to have that procurement policy and to have thought about that and talked about it within your team. Next slide. The other big piece is thinking about procurement logistics. So Diccon is going to talk about a number of opportunities that sort of fall into the waste bin. But I just want to highlight here how much of what is referred to as a frontline problem purchasing and procurement is. And that is an area where behavior change can really drive real change, right? So when it comes time or you realize you might need something, planning and preparedness, inventory management, things like that they seem small maybe, or they seem silly, but they're so important. This is the difference between you putting in a whole bunch of orders for single-use items and asking for rush shipping and all that type of thing versus the opportunity to like consolidate your shipment. Use things like Diccon will talk a little bit about some of the tote opportunities. Here's a screenshot from an article highlighting some of the things that MWI is doing to try to help clinics be more sustainable in their procurement and purchasing decisions. So when we sort of order strategically, thinking about or order quantities, you want to balance that sort of expiration and disposal need through good inventory management, but optimize, your shipping, that type of thing. The other is this idea of share networks. And so I've heard from some clinic cohorts where this has been helpful to sort of work as a community or where groups are coming together around some shared sustainability goals and visioning and opportunities where maybe you don't need to buy it, right? Similarly, knowing what is available in the used market and engaging in groups that are thinking about how to expand the lifespan of material or share resources that way. Next slide. And of course, mistakes happen. So for those that are not familiar with Project Animal Aid, I'm lucky to know some folks here. It's down the road from us here in Boulder. But this is an organization that effectively takes any sort of medical equipment from the human and veterinary supply chain, and it aggregates it. They have a ginormous warehouse and they make it available to largely nonprofit organizations really around the world that are doing sort of animal related products or projects. So know that you do have, this is not a solution or an excuse for sort of inappropriate buying, but we all know that mistakes happen. And also it's a good opportunity to partner and extend the lifespan of your materials. Next slide.
Thanks very much, Colleen.
No, I was just going to say, and I'll let Diccon highlight an example of opportunities to make better decisions.
Great, thank you, Colleen. So buying better. One example to really highlight is environmentally damaging plastic, like PVC. This is one of the most toxic plastics from manufacture to discard, and yet is also one of the most commonly used in healthcare, accounting for about 30% of medical device material. So PVC-based IV bags have phthalate plasticizers, which are added to make that brittle PVC flexible. But those phthalates are antigen disruptors. It can affect neurodevelopment and can promote chemotherapeutic drug resistance. And when incinerated, PVC product produces dioxins, furans, which are extreme carcinogens. PVC is also very challenging to recycle, although there are some now breakthrough methods. So we and others are ditching PVC medical materials and transitioning to PVC-free products like these by Fliboflex or Vetivex by Decra, which are instead made of polypropylene or high-density polyethylene. And there's a QR code here. And waste reduction goes hand in hand with improved, more sustainable procurement. In the US, the healthcare system produces about 6 million tons of waste annually. When I extrapolated for Canada based on limited Canadian information on 110 hospitals, to the thousands you have, it's likely close still to about 900,000 tons of waste every year. And waste prevention is really key. So let's talk through this waste hierarchy. The very first steps are to rethink and research all our purchases, as we were just discussing in procurement, and switch to reusable materials when possible, and become part of a circular economy of materials. To really try to refuse and reduce the use of disposable plastics when possible, repair materials and equipment, and then further down, recycle paper, metal, and most plastic materials and electronic equipment, particularly when otherwise unrepairable, but ensure to deposit in a waste stream that can utilize all those components. And then right down the bottom is going to be, rotting. So compostable material in appropriate aerobic sites that avoid the anaerobic conditions of landfill that create methane. Okay, methane being 80 times more powerful a warming gas than CO2 over 20 years, and 30 times over 100 years. And it's really important we do not place excessive emphasis on recycling. Recycling is important, but it's only one part, because yes, it decreases waste to landfill, but given all the upstream and downstream costs, including the transport of materials, for instance, 30 to 40% of all paper fiber products are transported in the US to Indonesia for reprocessing. And so we really have to think about some of those costs. Processing and remanufacturing, water, particularly for paper, energy for paper and aluminium. So it's really a very imperfect system. And we also should point out that recycling cardboard only saves about 30% of emissions when compared to that of sourcing virgin. Much plastic material is also downcycled rather than cross or upcycled due to other materials that contaminate or additives and colorants. So little can actually be recycled in the same level use materials, although I do know someone very close to me that is working very hard to make this problem much more easy to access high quality plastics for the future. Now, additionally, many buyers of recycled material refuse anything with medical labeling or the appearance of medical waste due to concerns of infectious contamination or medicine residues. And this is certainly the case for our recycling center. But we always need to recognize that we still have a huge amount of household simple materials that could be recycled in your local recycling center. Now, the next step is to understand the extent of your impact, and you really need to be able to measure and quantify this. And I recommend everyone does a waste audit. This is a great article on the right with a QR code by Dr. Duncan and colleagues. And it really goes through in great detail how to put together a waste audit. So it's a systemic evaluation of the type and amount of waste generated over a specific time. That could be a day or days, and then area. So it could be a department or the entire hospital. So then you're going to be able to identify the type and composition of waste generated, the patterns of use, and importantly, create a baseline for future comparison. And then you'll be able to identify ways to minimize your waste and create practical waste stream segregation streams. And I certainly suggest you reach out to your local waste facility and really engage and collaborate with them. They're a great resource and can certainly help you get started, particularly on understanding what can be recycled and what can be composted. And we had a representative group come out to our hospital to begin our process. We then did a much more formal waste audit with NG, collaboration with Mars Veterinary Hospitals. And we now more than 75% of our waste from landfill, with a potential to improve up to 82% with further optimization. Now, following that comprehensive baseline waste audit at my hospital, NG provided this information so we could create this infographic you can see here. And then what we did is we created a museum piece of all the material types and laid them out on this table of the different waste streams, and then staff could pass through and learn those various waste streams. And then after 2 weeks, we had small groups come back through and go through a table sort game, followed by a short PowerPoint presentation. So what we did is we took all those materials, we then mixed them up, they were clean materials, and we put them up on this table, as you can see here. And the small groups walked around the table and they'd pick up an item and put it in the bin that they felt was appropriate. We actually had 5 different bins for them to put them in. So this fun game really drove buy-in, engagement, ensured a practical understanding of what and how much can be diverted from landfill. So training your team is so important. And the first thing is you can really inspire them. We really showed, and staff were amazed at how much waste could be diverted. And start simple. Think about an early win, maybe a single waste stream like aluminium, and then have patience. Behavioral change really takes time. And then find allies, find charismatic influences that might be on your green team or elsewhere to help drive and evoke change. And it's really important to communicate the message clearly and repeat it. So we've done this about every 6 to 12 months. We've done this, and we've also done this for new staff members as well. And then we really want to acknowledge their efforts and reward and celebrate your achievements. So to get everyone on board, you want to educate why environmentally responsible waste management is so important, and then how. Facilitate and make it easy to do and understand so it becomes the norm and they want to do it rather than being a chore. And the importance of waste segregation and training is to ensure that we do not contaminate waste streams. Because if you substantially contaminate a recycling load, this may result in it having to be sent to landfill, depending on the ability of your recycling center to further sort. Identify generation points for target waste materials within the facility and place relevant bins at generation points and create waste stations by pairing bins together. What you don't want is staff having to walk across the room to put one part in landfill and another part in a different part of recycling or other. Then providing clean bin signage with color and position and replicating it throughout the facility is essential. And we've done that here. So this in the bottom, this is a nice example of similar bins that we have in our lobby. And then throughout our hospital, we're using the old bins that we've been, but they still have, they're colored. They're always in the same position. Then we have these little infographics that we got from our local recycling center, so that people always being educated and can refer back to these infographics in case they get confused, etc. Also, we have more detailed infographics in our break room. And we really want to ensure compliance at the site of origin. That's why training is so important. We do not want our custodians digging through the trash, trying to do waste segregation. And I always tell people, if in doubt, put in general landfill. Do not wish cycle. Do not contaminate those waste streams. And certainly don't put them in the sharps container unless it's a sharps. This costs, disposing of sharps is very expensive and has much higher emissions. So general waste should never go in the sharps bin either. Some very simple things to do: break room, office, reception. So we've transitioned back to proper crockery cups, plates, cutlery, and bowls in the break room. We have drink stations throughout our hospital and also in our client lobby. We've had really great feedback and from clients alike. And we really encourage use of reusable water bottles. We have these filtered water dispensers throughout our hospital, and as much as possible, try to limit disposables. Even if it's ostensibly compostable, it's still waste. And it's a very simple early win to help decrease that waste. And just one example for the office would be, printing on both sides, printing on 100% recycled paper, or preferably don't print at all. And we're getting close to being a very low paper use hospital. And then a simple and immediately implementable action is aluminium recycling. So making baseball-sized foil balls of suture material, as you can see here, or with scalpel packets. This size can be generally much more easily segregated than tiny, tiny pieces, which for some facilities, recycling facilities, going to be not easily segregated out. You can even do this in your break room with aluminium that you might have used for food as well. And then using these single-use sterile peel pouches instead of double pouching is sufficient for lighter surgical extras such as lap sponges, gauze, or maybe lighter instruments if unlikely to puncture. And then use of these reusable autoclavable tins can really help you decrease that blue wrap, which is actually polypropylene fiber. These surgical tins have been embraced by all our staff. They markedly reduce the for technician staff turnaround of the instruments, and the surgeons love that the instruments are really well laid out and kept in place, keeping a table tidy. In addition, I'd always recommend that you carefully review your main surgical kits and limit the need for routine extras that just increase waste. And certainly don't just open in case for surgery. Have them there on standby, but only open if really needed. Now, we're also transitioning to reusable textiles. Here, these are standard textiles. So reusable surgical gowns, instrument wraps. So some of you might not want to buy those more expensive aluminium tins for your surgery, but instead of using cotton, if you use these polyester instrument wraps, they have much reduced wicking properties. We're also using them for back table drapes and for things like patient drapes. So these are made of polyester, as I said. They're washable, autoclavable, and reusable 70 times, and they have a little chart that you tick off. They're AAMI level 1 through 4, so the higher the number, the greater water and wicking barrier properties, with level 3 being general standard of care. And then those garments can actually be returned to the manufacturer for recycling and repurposing. And they have massive reduction in carbon, water, waste reductions. And then when you compare them to disposables, and they also don't tear. Many of us have also been using these cotton washable surgical caps rather than the disposable ones. These actually lint and shed less dander. And then having your name or role can really help in a busy, large surgery practice, particularly if you have visiting surgeons or visiting surgical staff. Using surgery-specific shoes or reusable shoe covers can also dramatically decrease those disposables. And then long-term, our aim is to move away from disposable surgical procedure kits almost entirely and replace with reusables. And to do that, you're going to transition to a machine that does, you can have a steam sterilizer for your normal materials, but for those that are either are electronic and have simple wiring, or softer plastics, catheters, or maybe optics like endoscopes, you're going to need something that does not have heat or water, steam associated with it. And so historically, ethylene oxide's been used. This has major health and environmental concerns, including carcinogens and long cycle times. And so it now has entered into plasma peroxide sterilization, or this plasma bionic sterilizer, which we just purchased at our hospital. And this can also sterilize products with really long lumens. And this is going to really allow us to now transition to almost 100% reusables. Now, distilled water is also used for many things in the hospital. We use it for our autoclave, dentistry, laboratory equipment, coffee machine even. And I actually heard that one dentistry group was spending more than $7,000 a year on distilled water. Well, this is only a couple of $100, and even for a larger water distiller, it would only be about $2,000 or $3,000 maximum. So transitioning to one of these water distillers will cost you less over time. It's very energy efficient. There's no delivery emissions from transporting all that really heavy water, and no single-use plastic bottles. Now, there's often difficult to recycle materials, as we've been discussing, and many general recycling, for your local community can't take in more difficult to recycle materials. So TerraCycle and others have special buyer partnerships. An example is a multi-laminate food bag. So at our hospital, we have one in our food room, but we also have one in our lobby for clients to return their pet food bags. And this really helps us also promote sustainability actions to the clients and the community. Now, Mars Veterinary Health last year in a very short and small pilot in the UK and the US diverted more than 18,000 bags from landfill. And then there are also other to recycle opportunities like coffee pods, PPE, etc. One thing I want to point out too is many of these food companies are trying to transition to other materials, including better made polypropylene, so they can get rid of the multi-laminate bags and will be more easily recyclable. Further on, we now have worked with Mars Veterinary Health, and it's great to have their support for recycling those medical materials that otherwise just can't go into community-based recycling. And so this was custom. This was with TerraCycle and Rubicon, but they can take all the plastic shipping materials like LDPE, the pouches and bubble wrap, film, etc., that often can't be generally recycled. Anything with medical labeling or plastic packaging for medical supplies, even empty plastic pet food bags, those blue sterilization wraps that we were talking about, empty IV bags, etc. So this is a really great way for us to, again, markedly reduce even our medical material disposables that are very, very challenging to completely eliminate. And we have these nice little infographics posted throughout our hospital, again, helping direct people. And we had a huge education series of sessions around this. Now, as we all know, sharps containers are very vital to the safe disposable sharps waste from veterinary medical facilities. And reusable sharps containers are a great way to decrease waste. They can be reused more than 600 times. They're made much better, so they're safer with improved safety features, including decreased associated sharps containers by 85%. I guess that's particularly important in human healthcare, but it should be for us too. They cost less over time, and they're much more environmentally friendly. So it's estimated about 35 million sharps containers are made every year, with 95% going to landfill. So these reusables are going to reduce the associated greenhouse gas emissions from manufacturing as well as discard. And that goes back into Colleen's point about life cycle analysis. And then there are these downcyclable solutions for other materials that just don't have recycling, easy recycling options. And one of them is nitrile gloves. So Gamma Carbon program by Polycarbon is available in Canada as well. They offer a mail-back service for any brand of clean, non-soiled nitrile gloves. They kind of had contact with hazardous waste or pathological infectious feces, urine, etc. But that material then goes to as a binding agent for recycled tire crumb that replaces virgin fossil fuel derived binding agents like polyurethane. And then that's used in rubber flooring, mud flaps, construction cone manufacturing, and it's all done within North America. So that helps keep the gloves out of landfill. These bins are then filled up to about 40 pounds and they can be shipped back to Polycarbon. And we've collaborated with about 8 different hospitals now in our local area that are using that program. Just as a point out, in the last 17 months until the end of January, we had 323 kilos of, it's an amazing amount of nitrile gloves that we, just from our little hospital, pretty big hospital, that we managed to not go to landfill, and 367 kilos of carbon dioxide equivalent emissions that didn't go up into the atmosphere. And it's very important to listen to staff when you're rolling out these initiatives. So we had a lot of pushback. We had 6 different types of bins just getting cluttered. The waste stations were large. And the staff really started to push back. And so for some of these, we then put these little hanging bins, as you can see here. So an unsoiled, massively unsoiled glove would go into this little bin, which would then empty throughout the day into these larger bins. If it had, done a rectal, or it had, maybe contamination with blood, etc., that would either go into a normal landfill or potentially biohazard as needed. So this really allowed us to have make sure the staff felt that we were listening to them. We increased our engagement and really made them feel empowered, and then they were onboarded and much more likely to be willing to engage in other sustainability initiatives as well, which is really important. Now, when we consider avoiding waste, we want to really reduce the number of unnecessary non-sterile gloves used. And this is really an effective way to improve patient and staff safety, actually, reduce cost, and improve our environmental impact. These gloves can provide a true illusion of quality improvement. But in fact, there's a very clearly demonstrated increased risk of contagion cross-contamination when gloves are not removed promptly from after patient examination, or when insufficient hand hygiene is employed after use. And it's been found in many human papers, there's a potential increased risk of organism transmission in up to every second episode of human patient care. And I think that's a really significant statistic to consider. And medical gloves are the highest volume disposable medical device purchased by healthcare. For North America, it's somewhere close to 35 billion nitrile gloves a year. And the manufacturing of these gloves uses substantial resources and creates a lot of emissions. In North America, healthcare, this amounts to the equivalent of driving a car about 2.2 billion miles. There's also substantial emissions of methane and microplastics when they break down. Some of these take up to 100 years or more in landfill. And they can also even lead to hand dermatitis in 6% of people due to accelerants. So we know these are important medical device. They're essential if we're dealing with infectious patients, immunocompromised patients, if we're dealing with certain chemicals like chemotherapeutics, excrement, etc. But it's imperative to ensure that when we're using that medical device, we do it appropriately, because misuse and overuse can actually just cause more harm than good. And these concerns were really galvanized with UK health workers to create the Gloves Off campaign. It was run in 2018 at the Great Ormond Hospital in the UK and avoided 18 tons of plastic waste and saved more than £90,000. It's now been rolled out across the UK. and in many other countries as well have put in similar strategies. Now, there are also biodegradable solutions for some of these materials, including nitrile gloves. So Nitrale, made by Vetflex and KVP by Better Gloves. They are biodegradable, ASTM, 90% decomposition over 490 days. And they're also fully FDA approved medical grade gloves having the same properties and shelf life as standard gloves. There are also now compostable and biodegradable pill vials. Pharmacy Light are one of them, and they can biodegrade within about 50% over a year and a half. Composting throughout our hospital is very important. So every wash station and every bathroom, we have these compostable hand towels. And so that would then go into compost rather than landfill. Break room and lobby, we have general composting of food scraps and coffee grounds throughout a kennel. So food scraps, if you had pocket pets or maybe small, large animal, straw bedding, etc. And all our surgery prep and other prep stations, hair, animal fur from clippings, etc. would also go there as well. And now just for a quick montage of some of the other things you can do. I mean, certainly recycling used batteries. We have a program with our local waste hauler using plant or clay-based kitty litter. These reusable potty pads that we use that replaced probably 80–90% of our disposables at this time in our hospital. Again, that reprocessing of single-use medical devices. We have compostable poop bags. It's true, at least in California where I am, dog and cat feces cannot be composted due to potential risks of infectious agents, but at least that plastic gets broken down and doesn't make microplastics. And then we also have transitioned 100% to aquamation at our hospital. I don't have time to talk about this right now, but we can save maybe up to 90% of emissions when we compare that to traditional cremation. And I do know there is a facility in Ontario that's now also offering aquamation. And then reusable totes. So Mars Veterinary Health and MWI had a small initial pilot last year, and they avoided 80 tons of waste by reusing these reusable totes. Now these are being disseminated pretty freely throughout our areas. We now have them as well at our hospital, and they're hoping to expand service across the United States and into Canada. And certainly when we're thinking about procurement again and waste, we want to not buy what we don't need. So particularly when it comes to certain medications, so injectable medicines, because they're particularly high in emissions and environmental impact, and also the corollary impacts associated with things like antibiotics and antimicrobial resistance. For example, the costs incurred from expired medicine can be as much up to 2% of a practice's total revenue. So using a inventory management system like this one from MWI can really help reduce labor and space required, reduce costs and reduce the waste and emissions, as we've been talking about, and also improving compliance, both for veterinary practices and regulations, but also owner compliance for medication use, because the greatest waste of a medication is misused or inappropriately used medications. And briefly, for pharmaceuticals in practice, we want to appropriately dispose of pharmaceuticals with non-controlled substances into black bins. We want to have obviously regulated waste go into designated authorized offsite facilities like Stericycle or Daniels or wherever you use. And those empty medication containers can actually often go to landfill. And then you definitely want to inform clients of safe medication disposal. It's really important that we recognize that veterinarians should not take back medicines. What I tell clients is you should black out the label information, and unused medicines should actually be disposed. In Canada, you can take them just back to your local pharmacy or a designated take-back site or program. Potentially, you can also put them in a bag, just the medications with potentially coffee grounds if they really can't take them back to another facility, and those can then be placed in landfill. But the reason we don't want to do that is these black bins go into a landfill that's actually lined and really helps reduce the leaching of those medications into the environment. That's why it's so important. And really, we always want to avoid limiting flushing of any pharmaceutical. Now, anesthesia is also another important thing to consider. When we directly exhaust that waste anesthetic gases into the atmosphere, this can have substantial warming effect as well. So one of the things we really want to do is reduce the most egregious. So nitrous oxide, as you can see here in this article, so global warming potential over 100 years of nitrous oxide is markedly more than for sevoflurane, or even sevoflurane particularly. And then there's very few of us now using desflurane in veterinary medicine. I believe that some equine specialists were due to rapid recovery for horses. So discontinuing use of nitrous oxide is particularly important considering transition to sevoflurane. Also using lower flow gas anesthesia is important, but just doing better anesthesia, particularly around inhalants, is also important. Oftentimes we do use too much, and we should really, this is meant to actually say reuse. So we want to have rebreathing circuits, not non-rebreathing circuits. And I'm sorry that that was not taken out for anything greater than 5 kilo animals. Rebreathing circuits with pediatric circuits, lower resisted circuits, works really, really well. We should also think about good analgesia with opiates, judicious use of alpha agonists, regional block with local anesthesia, and maybe even total IV anesthesia, which can actually have up to a magnitude less emissions than even sevoflurane. When we put it into perspective, though, as a total warming, if we think about isoflurane or sevoflurane, it only accounts for about 0.01% of all warming emissions on Earth. And NHS, when they just consider again sevoflurane, isoflurane, it's less than 1% of their emissions. And we can take a look at the very bottom of the table here as well, that if we use sevoflurane for 1 hour at 1 liter per minute of oxygen, this is equivalent to only driving about 4 miles. And thus, most clients create more emissions driving back and forth from the hospital than are caused by using a sevoflurane. But still, it's a very important thing to consider. And finally, an emerging industry is anesthetic gas reclamation in Ontario, Canada. It's available and also in parts of Europe, but this is just getting started. Now, let's move on to transportation, and particularly promoting low emission transportation. So in Canada, when we think about greenhouse gas emissions by economic sector, we're looking at 22% of emissions coming from transport. And so we really need to think about how we both transport ourselves and our clients transport themselves to and from the clinic. 57% of those emissions come from driving passenger cars. Flying is also one of the most costly carbon emitting activity for an individual, with flying accounting for about 5% of transport emissions in Canada. So what can we do? Well, we can do things like, when we possibly can, walking or cycling, maybe taking public transport, and we can incentivize this as well. Certainly carpooling is something that we're working on at our hospital. We have e-bikes at our hospital. We had a huge grant. We now have 4 e-bikes for staff use, and we're installing 9 EV charging stations for both staff and client use. And this is a great collaborative effort with Sonoma Clean Power, our local utility. For our clients, also consider providing patient service through the least number of visits or utilizing some level of telemedicine. We're going to touch on that in just a moment. And then finally here, always celebrate your achievements. This is us purchasing our e-bikes, a picture of myself and one of my technicians, Jenny, when we went to do that. And we posted it. It's a nice way to distribute this information to the wider veterinary community in our area and also our clients. Now, I just want to make sure we're still kind of on time. We're almost at time. Sorry about that. So telehealth is very important as well. This can really help us decrease our emissions to close to zero, because when it comes to transport, there are some controversies surrounding this. And as a veterinary neurologist, I can tell you that doing sometimes a virtual exam is very difficult. But for vet client-patient relationships, this is important, and it can deliver timely care. There are various definitions. Telehealth is an overarching term used for delivery of health and education by virtual means in all respects. Telemedicine requires that VCPR, and Quebec and other provinces, including BC and Ontario now, this can be done virtually. But certainly you should contact your local jurisdiction to make sure that you are providing appropriate treatment. And then the Veterinary Virtual Care Association also has a huge amount of information, both for the US and in Canada. Finally, to water. We really want to reduce our water use where we possibly can. We know that water scarcity is a problem, with about half the world's population being under either water stress or having some degree of water scarcity. And per capita, Canada has third the highest water use in the world. Now, hospitals use about 7% of water in commercial and institutional US facilities. And so really trying to reduce our water efficiency can help decrease our operating costs by maybe up to 11%, our energy costs by a similar amount, and water use by maybe up to 20%. And these water sense label products are available in Canada as well. They've also been co-certified by the EPA. Certainly want to check for leaks, and your plumber can certainly help with that. Leaky taps can lose more than 1,000 liters a month. And ways to save water, obviously those aerators on taps, dual flush toilets are also a great way. Maybe xeriscaping your garden, rainwater collection, or using grey water, maybe from the laundry. We have commercial washers, which are larger. We use cold water on an eco setting using full loads, can also decrease water use. Distilled water again that we use, so trying not to transport that water to our hospital. And then for surgery, either using motion detectors, foot or hand paddles to turn off or on is really important, or use the sterilium or Avogard, which is a surgical hand rod, and can again markedly decrease water use. So today we looked at many aspects, and I'm sorry to have gone a little bit over, but hopefully you learned a lot. We talked about energy, waste, water, procurement, and transport. And our next webinar is on Tuesday, May 6th at 9:30 Pacific time and 12:30 Eastern time. Dr. William Sander and Dr. Katie Clow will be talking about our last part of that series on community. So please do join us for that, where we'll talk about community health, telling stories, making those connections, engaging with professional networks, talking about policy and advocacy for animal health and welfare and sustainability, and also looking at nature, conserving our natural ecosystems being very essential as well. So with that, I'm going to end, and I can answer any questions. Thank you so much for listening.
I don't see any questions in the chat. I see people signing off. If there's any last ones, we can certainly stay on to answer anything. Oh, Kim has a question.
Am I unmuted now?
You are.
Okay, all right, thank you. Dr. Westworth, I wasn't quite clear on what you were talking about with the aluminum. I'm not familiar with that. Could you just kind of briefly tell me what that was about again?
Okay, so aluminum or aluminium, you would have, so that could be from general food. So people bringing in aluminium, maybe packaging, purchasing food. So that can then be balled up instead of having small pieces. That is more easily segregated by your recycling facilities. Likewise, if you're in surgery, all the surgery packs, if you use those single packs of maybe PDS, Macron, silk, etc., nylon, you can ball those up also with the little aluminium packs from scalpel packets. And if you ball those all up into a baseball-sized ball, they are much easier for a waste facility to segregate. If they have tiny, tiny little pieces coming through, many of those segregators just can't separate those materials out as easily. Now, our facility right now actually is really high tech and uses eddy currents to do it, so they can. But for most, if you can ball it up into about a baseball-sized ball, that helps with waste segregation, and then they'll be more easily able to take out that aluminium and segregate it from the general commingled recycling. Does that make sense?
So the aluminum or aluminium is not recyclable. It's just easier to segregate.
No, it's recyclable.
It is recyclable.
That is recyclable.
Oh, okay.
Yeah, it's going to recycling center. But what happens is when they go to recycling centers, usually it's commingled, at least in California, it's commingled. So it's plastic, paper, and that aluminium, and it all gets poured in, all gets jumbled up with the glass and everything else. And then they have to go through these sorting mechanisms. And so the way that's done, for steel, they use magnets, or for anything that has a is magnetized, they use magnets. For aluminium, they use eddy currents. Anyway, so it goes through like that. And so some of it's optical sorting. Sometimes they use blowers and things like that. I actually recently went to my recycling center, and they had 16 different methods to segregate. And some of it's actually people on the line, but it's really complex and comprehensive. And if you have a recycling center in your area, I definitely recommend you go and have a look at how it's all done. It's really fascinating. For us, it's open to the public, and certain days you can go through it. So definitely worth thinking about. Yeah.
Okay, thank you. Yes, thank you for explaining that.
Okay.
There's one other question. Have you encountered any issues with biosecurity by doing more recycling or reusing?
Maybe I have to have them specify more carefully what biosecurity they're talking about exactly.
Or maybe they're sort of meaning infection control.
Yeah. So we don't, at least in California. For us, if it's, not fully blood soaked, if there's just some blood on it, if there's some feces or some urine, some saliva from a non-infectious patient, that can just go to landfill. If it's a piece of, and this is really going to other questions that, I would say you should either contact Stericycle or Daniels or whoever is your infectious waste specialist group. So I want to be careful to speak carefully for your area. But, for anatomical materials, for blood soap, for things like that, yes, and certainly from infectious, that would need to go into a biohazard waste bin. Obviously, if it's chemotherapeutics, that should go into a chemotherapeutic waste bin, which those actually get incinerated. So at least in California, all chemotherapeutics are incinerated. So I hope that clarifies things for you.
Yes. Okay, that looks like all of our questions for today. But certainly if you have other ones, feel free to visit Veterinary Sustainability Alliance website. There's a contact form and our emails there as well. And we hope you can join us in a couple weeks for our final webinar. And thank you to CVMA and CAS for sponsoring this webinar today. Have a great day.